Most men only discover these diseases when it's already too late. And the truth is, 1 in every 2 men over the age of 50 is living right now with a silent condition that could eventually lead to cancer, kidney failure, heart disease, sexual dysfunction, disability, or even death, and they have no idea. Simply because they never tested for it. Not because they didn't care, not because they weren't smart, not because they didn't love their family, but because they believed the most dangerous sentence a man over 50 can say, "I feel fine, so I must be fine." I'm Dr. Rena Loeb, urologist, and if you're a man over 50, or if you love one, this may be one of the most important conversations you will ever hear. Not because I'm going to scare you, but because I'm going to do something most doctors never take the time to do: explain clearly, calmly, and scientifically why 3 simple tests can literally save your life, and how you can ask for them before symptoms ever appear. I'm not here to sell you supplements, miracle cures, or internet shortcuts. I'm here to help you live longer, move better, think sharper, stay sexually active, and protect the body you worked a lifetime to build. And it starts with one powerful shift in mindset. After 50, health is no longer about how you feel. It's about what you can detect early enough to prevent. The first test is the PSA blood test, prostate-specific antigen. You've probably heard of it, but most men don't understand what it actually does. The PSA test doesn't diagnose cancer. It detects silent changes in the prostate that may eventually lead to cancer, inflammation, or uncontrolled growth. And here's the reality most men don't know. Prostate cancer is the most common cancer in men, but it is also one of the most curable cancers if it is found early, before it leaves the prostate. Early-stage prostate cancer has a survival rate of 98 to 99%. Late-stage prostate cancer has a survival rate of 30%. That difference is not luck, it is timing. The American Urological Association, Harvard Medical School, and Mayo Clinic all agree that after age 50, regular PSA screening is one of the most powerful tools we have to detect cancer before it spreads. And yet millions of men still avoid it because they think it's painful, complicated, or unnecessary. In reality, it's a simple blood test that takes less than 60 seconds. A high PSA doesn't automatically mean cancer. It can be elevated because of an enlarged prostate infection, even bike riding before the test. But a rising PSA, especially when compared over time, is an early warning signal you cannot afford to ignore. And today, we don't rely on PSA alone. We have free PSA, prostate MRI, genetic markers, and targeted biopsies that are far more accurate than what existed 10 or 15 years ago. The science has improved. The outcomes have improved. The only thing that hasn't improved is how many men actually go test. If you're 50 or older, and especially if you're African American or have a father, brother, or uncle with prostate cancer, you should not delay your first PSA test. The second test almost no man asks for, but every man over 50 needs, is the kidney function panel. Kidney disease is called the silent killer for a reason. The CDC estimates that 37 million Americans have chronic kidney disease, and 90% of them don't know it. Not because they're careless, but because kidney damage gives no pain, no swelling, no early signs. It just gets worse year after year, until one day the doctor says the 2 words no patient ever wants to hear: you need dialysis. Men are at higher risk than women, and the number 1 risk factor isn't poor nutrition, it's age. After 50, kidney filtration naturally declines, and that decline is accelerated by high blood pressure, diabetes, dehydration, long-term use of painkillers like ibuprofen, smoking, and even untreated prostate enlargement that blocks urinary flow. The kidney panel, creatinine, eGFR, urinalysis, microalbumin, gives us a window into what your kidneys are doing before they fail. You don't want to wait until symptoms appear, because when kidney symptoms appear, you're already in late-stage disease. And kidney failure doesn't just affect the kidneys. It affects your heart, your brain, your blood pressure, your ability to produce hormones, your energy, even sexual function. The good news is that when kidney decline is caught early, you can slow it, stop it, sometimes even reverse it with hydration, salt control, blood sugar improvement, and lifestyle changes. But it starts with a test, not a guess. The third test is testosterone combined with metabolic markers. Testosterone isn't just a sex hormone. It is a metabolic, cardiovascular, and brain hormone. Low testosterone is strongly associated with increased abdominal fat, insulin resistance, depression, fatigue, muscle loss, osteoporosis, cardiovascular disease, and even earlier death. After 40, testosterone naturally drops 1 to 2% per year. By 60, many men have levels so low they would have been considered abnormal at 30. And yet most men never test it unless they already have erectile problems, which means they're already late in the process. That's why I don't recommend testing testosterone alone. I recommend testosterone plus metabolic markers, fasting insulin, A1C, LDL, triglycerides, HDL, SHBG. Because hormones don't decline in isolation, they decline as part of a metabolic shift that affects your entire body. Low testosterone doesn't automatically mean you need injections. It means you need information. The test lets us understand why your levels are low: obesity, sleep apnea, alcohol, stress, vitamin D deficiency, medication side effects, or true testicular failure. When you know the cause, you can treat the problem. Some men reverse low testosterone naturally. Some need medication. Some eventually need replacement therapy. But you can't fix what you never measured. And here is what most doctors never say out loud: low testosterone is not just a quality of life issue, it is a mortality issue. Men with chronically low testosterone have higher rates of diabetes, heart disease, and early death, even after adjusting for age and weight. That means this test is not optional. It is essential. So now you know the truth. 3 simple tests, PSA, kidney function, and testosterone plus metabolic markers, can give you more information about your future health than any supplement, any wearable, any anti-aging hack, or any guess based on "I feel fine." If you're 50 or older and still haven't done these, the best time was last year. The second best time is now. Don't wait for symptoms. Don't wait for pain. Don't wait for the emergency room to be the doctor who finally checks your blood. You've spent a lifetime being strong for other people. This is your moment to be strong for yourself. And if you want me to create a full video explaining how to read a PSA, or how to protect your kidneys, or how to support testosterone levels naturally, let me know in the comments. I read them and I make videos based on what men actually want to understand. If this video helped you, share it with someone you care about. It might save his life. And if you haven't yet, subscribe, because I'm here to help you live longer, live stronger, and stay in control of your health, one smart decision at a time. Take care, and I'll see you in the next video.